Now it's time to hear from Dr. the Honourable Christopher Tufton, Jamaica's Minister of Health and Wellness, and a champion for healthcare and wellness at the same time. Mark, welcome.
Thank you very much, Madam Chair, and I think that you will be the first patient for these machines. But so far, so good. They're sounding very healthy. All right, so let me begin by recognizing you, Madam Chair. Thank you for the management of the proceedings. My colleague, Minister of Health and Wellness, Minister of State, Juliet Cuthbert-Flynn. I want to really recognize her particularly because she's a driver of the maternal health program in the ministry. She really should be giving the speech, but she insisted that I do it, but I want to recognize her. Thank you very much, Juliet. Mr. Dr. Trevor Dixon, founder and CEO of JAHJAH Foundation. I came here last evening and he was not as appropriately attired because he was working mode in his shorts and all with all the other members, many of whom are not here. I should say that they're about what, 40? 45. Indeed, if anybody from the Pegasus is here, we deserve a commission because we have about 100 healthcare workers around staying in the hotel. 3 delegations, the JAHJAH Foundation, there's another group, OID, who will be at UWI doing heart surgeries, and there's the Code Care second batch of nurses who are going to be at Bustamante Hospital to do backlog surgeries. So the Pegasus is doing very well as a result of and of course tourism also. Thank you very much. So we did have a little chat, and a lot of work has gone into getting us in this formal setting. So I want to recognize Mr. President, CEO, and all the other members, of course, of the JAHJAH Foundation. Of course, Wendy Hart, President of the American Friends, needs no introduction, a long-time friend, and of course doing an excellent job with other members of our team. Thank you very much, Wendy. Please pass on full membership. I see Ms. Laura Tanner here, who is a member of the director, and also Alex Clark. Where is she? Oh, there she is in the back there. Thank you very much to the American Friends. And if you can afford to go to that gala event in Florida, please do, because we can take the money, right? Here. But excellent organization and really doing a good job. Thank you very much. To the members of the, well, let me recognize Ms. Clayton, Director, Training and Education, Butterfly Network. Thank you very much for being here, and thanks for helping to coordinate the technology. My team, who are here, too many to mention, members of the Ministry of Health and Wellness. I see Dr. Ennis and others. I want to recognize all of you and thank you, of course, for the coordination. The CEOs and the SMOs and the members of the hospital community who will benefit. I understand all hospitals will benefit from these devices. I want to just thank you for being here, for supporting, and of course, we have a lot of work to do, and we're now empowered to do even more. What all of this points to, this very long introduction, but necessary run up to the wicket, is that partnerships do really work. Yeah. And with the right coordination, with the willingness, with the attitude towards doing and serving our mandate, we are far more effective as a team rather than as individual silos. And I think this is a manifestation of that. And we all deserve a very big round of applause for agreeing. As I said, there are 100 or so healthcare workers in this precinct over the next week doing different things. And I feel proud to be leading a team that I think that over the last number of years have really embraced and reinforced their efforts to collaboration and partnership. I have Mr. Cephas here, who is head of our foundation, which has been enhanced with a larger contingent of workers approved by the Ministry of Finance, a new office setup, new budget, and the intention is really to make the gifting towards public health and health generally a critical part of what we offer normally in our normal course of activities. Because as we can see, and we are part of this, there are many persons, many entities who want to contribute, who want to give, who want to be a part of making a difference. And what we have to do is to make that easier so to do. I've heard that the baby box that should have been here is still on the to be cleared. I hope it's cleared by now. So there are some conversations that have to take place to ensure that we enhance the efficiency of the process. But I think we're on the right track, and I want to commend those who, despite the obstacles, have continued to move in this direction. So this partnership today, the Start Right, latest maternal and newborn health initiative to come out of this partnership, including, of course, the organizations and the Ministry of Health and Wellness, targeting, of course, vulnerable mothers in the first instance with care supplies, while also delivering a very important aspect of diagnostics for maternal health. The intervention is indicative, hopefully, of the priority that all of us here, but certainly the ministry, is placing on maternal health benefits and the importance of that to human development, to economic development, to social development, to society. We don't talk about it often enough. More often than not, we identify the challenges and fail to recognize some of the root causes. It really starts from the womb, and it starts from the community. It starts from how we take care of ourselves, and by extension, those we are responsible for. And oftentimes, I think if we don't correct that, then some of the other issues that we have in our society will continue. So we're focusing on pregnancy with the donation of and the provision of training on the use of these portable ultrasound machines, and after pregnancy with the donation of needed supplies to aid in the care of both mother and child, which is very important. 24 machines, I'm told, that are going to be donated to 10 hospitals initially island-wide. And I say initially because I know after the Florida event, another 24 machines. I'm talking it into being, right? So the obstetric units and in our accident and emergency, so we're going to use in the two critical areas. The hospitals that will benefit, I understand, are Victoria Jubilee, Kingston Public, Cornwall, Black River, the University Hospital of the West Indies, Sablamar, St. Anne's, Maypen, Princess Margaret, Mandeville Regional, and Spanish Town. Very, very busy entities, institutions, so it will come in extremely handy. The value of the donation to enhance is really enhancing the care that we spoke about, the diagnostic care, and to safeguard the best health outcomes, which is a critical part of our mandate. I've already done so, but I'll do so again. I want to recognize the American Friends who have financed the ultrasound devices to the tune of some US $25,000. And even though we don't have on display the Snuggle Nest as part of the overall program of outreach for maternal care, I want to also recognize American Friends who have initially contributed, I believe, 100 of those, with another 2,000 or so to come. I don't know if you have the picture on the screen. What is good about this, and I'm really happy for this, because 5 years ago I went to Europe and saw what is referred to commonly as a baby box, which is used a lot in the Scandinavian countries, also in the UK. which essentially incentivizes mothers to attend clinics with a gift, if you will, not just the actual box crib, for want of a better word, but also supplies that will help in terms of the maternal care for the child. And so every time the parent, the mother, attends clinic, they would add something to the box. And that was an amazing idea because in Jamaica, I don't know if you know, some do, many of the doctors, if you work at Victoria Jubilee Hospital, the largest maternal institution in the Caribbean, you recognize that some mothers don't turn up until the baby is literally ready to be delivered. And you don't know, right, Dr. James, if the baby is upside down, crossway. And when I discovered that as minister, I recognized how much of an expert our doctors were. Because they literally have to do the diagnosis on the fly. And I am not exaggerating. And both the diagnostic equipment, the handheld, will certainly assist that, but also this snuggle nest will also be critical. The intention is to use it, starting with vulnerable mothers as a pilot, and hopefully incentivize them to come to the clinic for prenatal care, and then hopefully allow the health system, doctors and nurses, to better understand their particular circumstances and give the babies and mothers the best possible outcome. So we are going to be piloting this, and if it works, we are going to be mainstreaming it across the board. So really excited about it. I'm sorry we don't have Of course, the JAHJAH Foundation has been ongoing 15 years, is it? You don't look much like, I mean, you age well. You're a founder, right? You started very young, okay. But, you know, it is always more rewarding to give than to receive. So I'm sure that has contributed to your keeping young. But the JAHJAH Foundation has been a critical part of the program. My understanding is that you have several executions this week. This is just one, which is why some of your members are not here. And I want to just especially recognize and celebrate you. The issue of maternal care, and I'm going to sit now, but for the purposes of justification as to why this is important, is very critical. I mean, the ultimate end, of course, is to have healthy babies. And mummies, right, of course. To ensure that, you know, they have the best outcome, that they can develop and they can mature, like we all have, and find their rightful place in society as you know, valuable contributors to life and to happiness and so on. That's really the objective. Now we have some targets that we focus on. There are some global targets out there that are important to appreciate. In Jamaica, we are trying to reduce our maternal mortality ratio to 70 per 100,000 live births by the year 2030. We're some ways from that. We, I am told, are 110 per 100,000. In 2016, we had gone down to 93.5 per 100,000 in 2018, and the preliminary data in 2019-2020, those terrible COVID years suggest that it has inched back up. I don't have this specific number. But that's something that we have to keep working towards. So it's a target that we have not yet achieved, but I think we have it in us to make that achievement possible. And so the efforts today by this group of volunteers, of contributors, is to bring that target down in the interest of our mothers and our babies, and by extension in the interest of our society. I want to thank you again for participating. Thank you very much for all the efforts that you have made. And I want to just encourage our doctors, hospitals, nurses, as they continue to work hard for the benefit of the patients that they serve. Thank you.